I'm proof of anything, it's that there is absolutely no one size fits all, particularly when it comes to PCOS. PCOS is not a tick box exercise. It is not you've walked in here, you have a beard, you are overweight, you have not had a period ever. I remember being in biology textbooks and that being the person that I was shown who was the PCOS model. That is some people's experience, but it's not everybody's. I was diagnosed with PCOS 2 years ago. This was after a stint of not having had a period for about 3 years. I first knew or thought something was up when, despite taking the combined contraceptive pill, which I'd been on since I was 15, I wasn't getting any bleeding. So I decided to come off the pill. I never really thought something was wrong. I just thought maybe I've been on contraception for too long and it would be good to have a change. And about a year and a half later, nothing had happened and I went back. And this is where it started to get really confusing. The doctors were suggesting that maybe I was over-exercising or under-eating. I went to another doctor who said maybe I'm overeating or my diet's not healthy enough. One doctor suggested that I would be prescribed basically a ovulation stimulant called Clomid. And I took that duly and I was very excited when I thought I'd got my period, brilliant, it's worked. And I think it lasted for about an hour. And then back to nothing. The confusion was just too much. No medical professional was able to give me an answer despite getting blood tests, despite going to see different doctors at my GP. It was just a very confusing time, a time where in my late 20s, we had other friends who were settling down, beginning to have babies, family members as well. And for the first time, I was thinking, oh no, what happens if I can't? Because it was something that myself and my husband wanted. My GP wasn't able to give me a definitive answer, but I did have this distinct feature of having a complete lack of periods, so that was one warning sign. And luckily enough, I was working for a women's health app, and as part of their offering for employees, they were able to offer something called an AMH test, and essentially having high levels of AMH signifies that you've got a lot of, I believe, follicles that haven't developed, which would suggest, again, that you might have PCOS. And sure enough, it came back a week later and it showed that I had very high levels of AMH. So that, combined with the lack of periods, was two quite clear warning signs that I might have PCOS. And I was kind of armed with this information and able to then go to my GP and request to get a proper scan of my ovaries. And the woman just said, oh yes, yeah, you've got polycystic ovaries. And that was it. And I was sort of waiting for I kind of wanted an explanation. I almost wanted an apology. Obviously this woman there, that was not, she didn't know what my history had been, but this was 3 years down the line. And in that time I had had other scans and I had had blood tests, and I felt relieved once I'd managed to process it, because I just was so glad to have an answer. But it felt like a kind of letdown of a big moment. And at that point you think, this is great that I've got an answer about what's wrong, but what on earth do I do next? My GP did speak to me about the results eventually and suggested that I went onto a medication called metformin. And after about 2 months of taking the metformin, I did get a period back. And there it was just a slow road to kind of getting back into your rhythm, I suppose. I mean, I've been tracking my cycles for the last 4 years, I would say, particularly to begin with. you know, they could easily be 30 days, 50 days, 60 days, 40 days, 70 days. So the metformin worked, and then gradually I came off that and just carried on as usual. I feel that a lot of it has been me listening to my body, figuring out what works for me, tracking, not because I've been told to track, but tracking all of my symptoms, tracking the start and the end of every period, what it's like, just off my own back, because I've wanted to kind of empower myself any way that I can. I think I really want to spread the message that all of these experiences are normal and they are happening, and there should not be any element of shame that surrounds them, because I actually think that shame often leads to denial and often leads to people not going back to the doctor, even if the first time they hit a dead end. Because it's that persistence that will often get you where you need to be nowadays. But if I can encourage other women to listen to their bodies and to be really honest about their own experiences and to advocate for themselves in whatever way that they can do, and to keep going when they know that something's not right until they get the answers that they need and the support that they need, I feel like I've done my job then.
Hi, I'm Dr. Sam, a GP of over 20 years and the Women's Health Clinical Lead at Bupa. As I've specialised in women's health throughout my career, I have seen a lot of women with polycystic ovarian syndrome and have supported them on their treatment journey. Polycystic ovarian syndrome is a common condition affecting women of reproductive age, so it affects about 1 in 10 women. We don't know why it occurs, but it does cause abnormal hormone levels, and these can cause insulin resistance in the body as well. So it can lead on to what we call metabolic consequences, so a higher risk of developing diabetes, high blood pressure, high cholesterol, and therefore heart disease as well. So it's characterised by a woman often having irregular periods. She may have excess hair growth on her face due to higher what we call androgen levels, so these are the male hormones that can occur. She may suffer more with acne as well, and she may suffer with hair elsewhere on the body too. She may also experience problems with her weight. On the ovaries, we see lots of enlarged follicles. So although it's called cystic ovaries, it's actually follicles that we're seeing. And these are where eggs usually grow each month. But this doesn't happen with people with polycystic ovaries due to the abnormal hormone levels. So they're not ovulating and releasing an egg each month, which is why their periods end up being irregular. It is often misdiagnosed or undiagnosed because there are so many different symptoms and they can overlap with other conditions too. We also find that over half of women don't experience any symptoms, so they may not find out that they have polycystic ovaries until they struggle to conceive or get pregnant. So if a woman does feel that her symptoms aren't being taken seriously, it is important that she seeks further medical advice. My message for a woman living with polycystic ovarian syndrome is to advocate for yourself, understand as much as you can about the condition and get that support and help and treatment that you need, but also to do everything that you can for yourself to live a healthier lifestyle as you can, as we know that this will help manage your symptoms and enable you to live a fulfilling life.